Welcome to The Explainer. Today, we're diving into one of the most intense battles fought inside an ICU, acute respiratory distress syndrome, or ARDS. All right, let's get right into it.
You know, you'd think a condition this critical would start with some rare exotic disease, but nope. Often, the whole thing gets kicked off by something we're all familiar with, like a really bad case of pneumonia, or a body-wide infection like sepsis. It's a threat that can sneak up from a very common starting point.
And that's what makes ARDS so unbelievably frightening. It can take a manageable illness and, in a flash, turn it into a life or death crisis. It becomes this true, desperate battle for every single breath, where the body is literally at war with itself.
To really wrap our heads around this, we have to go inside the lungs. We need to get a look at the microscopic battlefield where this whole siege is taking place.
So, what is ARDS really? At its core, it's a massive, sudden, and widespread inflammation of the lungs. The easiest way to picture it is to think of your lungs millions of tiny air sacs, the alveoli, like tiny little balloons. In ARDS, the super delicate lining between those balloons and the blood vessels around them gets damaged and starts to leak. This lets fluid pour in, and the little balloons get totally waterlogged, making it impossible for them to fill with air.
And this really shows you the night and day difference. On the left, a healthy lung. The barrier is strong, the air sacs are dry, and oxygen moves smoothly into the blood. Simple. But then you look at the ARDS lung on the right. That crucial barrier is broken, fluid is flooding in, and that vital gas exchange just grinds to a halt. It's like the lungs are drowning from the inside out.
So what kicks off this internal attack? Well, it can be a number of things, what doctors call clinical insults. Sepsis is the big one, the most common trigger from a body-wide infection. But it can also be a direct hit to the lungs, like from a severe pneumonia, and we all became very familiar with this thanks to COVID-19, or from major trauma, massive burns, or even from accidentally inhaling stomach contents.
Okay, so with the lungs under attack, the next critical step for the medical team is to identify the enemy for sure. How do they know it's actually ARDS and not something else that causes breathing problems?
The key here, and this is super important, is the timing. ARDS is defined by how fast it happens. As you can see on this timeline, the severe breathing problems have to pop up within 1 week of that known trigger event. That rapid, sudden decline is a huge piece of the diagnostic puzzle.
So, doctors basically use a three-part toolkit to nail down the diagnosis. First, blood tests show that oxygen levels are dangerously low, and crucially, they don't get better even when you give the patient a ton of extra oxygen. Second, you look at images, like a chest x-ray. You'll see these white, cloudy areas across both lungs, which is all that fluid. And third, like we just said, the timing has to be acute, which helps rule out more long-term lung diseases.
Once ARDS is confirmed, the game plan totally depends on assessing the threat level. Not all cases are created equal, so figuring out just how severe it is becomes the next absolutely critical step.
This is the big question. It's the one every doctor, every nurse, and every family member is asking. And thankfully, there's a very specific way to find the answer.
They measure severity using something called the P/F ratio. Just think of it as an efficiency score for the lungs. It shows how well the lungs are using the oxygen they're being given. A lower number is bad news. As you can see in the table, a ratio between 200 and 300 is considered mild, and the risk of mortality is around 27%. But if that ratio plummets to below 100, well, that's severe and the risk jumps to over 45%.
This chart really just drives that point home. You can see the risk climb with each stage. It's a stark reminder of why getting that severity level right is so important. It dictates just how aggressive the fight is going to be.
So, the enemy has been identified, its strength has been assessed, now it's time for the ICU team to launch the counterattack. Let's look at the strategies that become the patient's absolute lifeline.
The entire approach to managing ARDS is built on these 4 pillars. And notice, it's not just about the lungs, it's a holistic battle. You have to directly support breathing, of course, but you also have to carefully manage fluids, fuel the body for the immense stress it's under, and make sure blood is still getting to all the other vital organs.
Now, this might sound pretty strange, but it's actually one of the most effective tools they have in their respiratory toolkit. Why on earth would you take a person who's critically ill and put them on their stomach for most of the day?
The answer is so simple, it's brilliant. It's all about gravity. See, when a patient is lying on their back, all that fluid in their lungs pools in the back parts, squishing them shut. By flipping them over, what's called prone positioning, gravity helps that fluid shift away, allowing those collapsed sections of the lung to pop back open and finally get some air and oxygen. It's low tech, but it's a total game changer.
Okay, now let's talk about that fluid pillar. This is a constant tightrope walk. Give the patient too much fluid and it'll just leak right into the lungs, making the ARDS even worse. But give them too little fluid and their blood pressure will tank, starving their organs of the blood they need to survive. The team is constantly trying to keep them on the dry side, just enough fluid to keep the organs happy, but not a drop more.
And on top of everything else, the ICU team is fighting on multiple fronts at once. They have to be constantly on guard for all these other threats. The patient might start fighting against the ventilator, their blood pressure can become unstable, their kidneys can start to fail, and their body can get so desperate for energy that it starts breaking down its own muscle. It is just a relentless 24/7 battle. Surviving that initial brutal assault is just the first part of the war. Now we need to look at the long road to recovery and the absolutely vital role that education plays in the aftermath.
In this situation, communication is basically a form of medicine. An ICU is a scary, overwhelming place, full of beeping machines and alarms. Just explaining what everything does, why the team is turning their loved one over, and setting realistic expectations can make a world of difference. It reduces anxiety and makes the family feel like they're part of the team, not just helpless bystanders.
This quote really gets to the heart of a hidden but critical battle. When the body is this sick, it goes into a state of what's called severe protein catabolism, which is a fancy way of saying it literally starts eating its own muscle to survive. That includes the muscles you need to breathe. This is why getting nutrition started early isn't just a nice to have, it's a core part of the counterattack that preserves strength for the fight ahead.
And it is so important to remember that the fight is far from over when a patient is discharged from the ICU. Surviving ARDS is often just the beginning of a long, difficult journey that involves tons of physical and pulmonary therapy to rebuild the strength and reclaim the lung function that was lost in the battle.
So, ARDS is a brutal, relentless condition that pushes the absolute limits of what modern medicine can do. But every time we see a patient survive this incredible siege, it leaves you with a question to ponder. What does this intense, microscopic war inside our own bodies truly teach us about the profound and sometimes just unbelievable resilience of the human spirit?